Good afternoon. We'll call the December 1st, 2020 Grand Forks County Commission meeting to order. Please note for the record that all commissioners are present either in person or via Zoom. First order of business, I guess, is the election of chair and vice chair. But before I begin that, as I'm closing out my year as a chair, I wanted to take this opportunity to express my sincere respect and gratitude to each of the commissioners and to the Grand Forks County staff for their support, patience, and your collaboration during a very difficult and trying year. And so I just want to thank you for your spirit of teamwork, your dedication, integrity, courage, and passion for the important work that you do each and every day for our community. So thank you. So the first order of business then is the election of chair and vice chair for the coming 2021 year. And do I have a motion for election of the chair?
Madam Chair.
Yes, sir.
Commissioner Ross, I would like to nominate Cynthia Peach as the chair for the next coming year.
Okay, thank you. We have a motion to elect Cynthia Peach as chair. Do we have a second?
I'll second that, Tom.
Thank you. So we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? Motion carried. Welcome, Ms. Chair. And then the next item is for vice chair. Do I have a motion for a vice chair?
Madam Chair, this is Dave.
Yes, David.
I'm sure Tom looks forward to being vice chair, so I would recommend him or move that he be vice chair.
Madam Chair, I would second that
All
motion.
right, we have a motion and a second then for Tom Falk as vice chair. All in favor signify by saying aye.
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 Opposed? Motion carried. So we'll turn it over to our new chairperson, Ms. Peach.
Well, thank you. And again, gratitude to Diane for everything she's been through this last year. And I have big shoes to fill. So please be patient with me as I stumble through. The third item on the agenda is the approval of the minutes. Do I have a motion?
Madam Chair, Commissioner Ross, I so move.
Is there a second to that motion?
I'll second the motion.
All right, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. The fourth item on the agenda is the approval of the order of agenda. Does anybody have anything they'd like to add to our current agenda? If not, is there a motion?
Motion to approve, Tom.
Okay, is there a second to that motion?
Second.
Assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. The fifth item on the agenda is the approval of the consent agenda. And you will notice that it's a little lengthier. Bills, employee status, overtime. There's a county deed, beer and liquor licenses for three venues, excuse me. And there are 2 game of chance permits. Would anybody like anything pulled from the consent agenda? If not, can I have a motion?
I'll make a motion to approve the consent agenda as presented.
Is there a second?
Second, Tom.
Great. Assuming a roll call vote, all of those in favor signify by saying aye.
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 Opposed, same sign. The motion is carried. Our sixth item on the agenda is public health. Do we have Debbie Swanson available?
Good afternoon, Madam Chair and members of the commission. Yes, I am here, and I also is Michael Dulitz, who does our data analytics. And Michael has a presentation on the COVID-19 situation, and then I will follow up with a little bit of an update on vaccine and vaccine delivery and answer any questions that you might have. So I'm going to turn this portion of the update over to Michael.
Thank you, Ms. Swanson. Mr. Dulitz, are you available?
Can you see my screen?
Okay, yes, and I believe Debbie is going to share it with the rest of us.
Well, I guess I don't know how to do it. That's usually not how it shows up.
We
I
see
just
it
have
out
to-
here.
I know.
Say Gerald.
Did the
I'm
slides
gonna
advance?
send
Okay.
That guy in Mackinac,
Huh?
I'm gonna send him a letter because I don't have a number for him.
It says exit.
And tell him
Hey,
we're not.
Nick, can you mute your microphone?
That's in the city, I mean, not really in the city, but. we
I
didn't
don't
put-
have anything to make this
Like our
larger.
building, we didn't put the house numbers up there either.
Right, yeah, we don't, Ryan's like, well, we don't put them up in any towns. I'm like, really? Well, I guess I never.
Nick, I think you're yeah, there. Perfect. Are you able to see the slides okay in the
They're
room?
tiny, tiny.
Oh,
So I don't know how to make it big.
Yeah, ours are big on my computer. Mine are fine.
Hey, Debbie, in your
Mine
in your
too.
top left, or I'm sorry, in your top right, is there a view that you can click on and it gives you a different view option?
Here? Where? Here, I mean.
It's under the
Okay.
arrow up on the left here. Right here, what's that?
This one?
Was it?
Yeah,
oh,
it takes it completely away.
Yeah, and the camera's not gonna help. The speaker's not gonna help.
Okay.
Sorry for the
So for
technical
some-
difficulty here.
Ah, Exit
Exit.
minimize.
Oh,
Oh, there we go.
Oh.
All right, we do have it up, Mr. Dulitz, and we will mute our speakers if you're not going to be speaking. And we'll mute our speaker as well, Michael, so that you can present.
sounds good. Thank you, Madam Chair and members of the commission. My name is Michael Dulitz. I'm the Opioid Response Project Coordinator at Public Health during normal times. And I'm pinch hitting right now as the COVID-19 data and analytics leader. I'm just going to provide a brief update where we're looking at with our COVID data. So fortunately, we are on a pretty steady downward trend right now with our COVID-19 new cases and our case averages. So since about mid-November, we've been starting to see the corner kind of turn on our new case rate of COVID-19 cases. So initially I was a little bit hesitant to say that we were moving, we were changing direction or anything like that, but I think we can safely say that we are on a downward trajectory right now. With that downward trajectory, we've also been seeing a decrease in our percent positivity, as well as a decrease in the number of cases completed, the number of tests completed, which is the only reservation that I have, but I'll go into a little bit more detail. So looking at our testing average, we have, since the beginning of November, we saw a pretty steep increase in the number of tests that we were completing as a county as we saw the surge in new cases. So that was one of the driving factors that led us to believe that this was kind of a new outbreak in the community or new spread because there were a lot of unique tests. So we saw a pretty hefty increase in the number of unique tests that we were doing. And then we also saw an increase in the number of serial tests that we were doing as our other community partners, such as long-term care facilities, had to increase their testing to match the needs of the community. We've seen that decrease some now over the past week or so. Likely a lot of that is due to the holiday, as potentially individuals didn't want to receive calls during the week of the holiday that they were potentially positive. So that is something, the testing volume is something that we're going to have to keep an eye on moving forward. Fortunately, all of our metrics are moving in the same direction with that. So looking at our percent positivity has been on a downward trend, which does give us some confidence that what is happening with our decrease in case numbers is in fact a true decrease in case numbers and not a decrease due to a lack of availability of testing. So right now we are at about 7.6% for our percent positivity average, which is some percentage we haven't seen since early October. I do still want to see that continue to go down. The sign of a good testing program would be to get that into that green or yellow area where our percent positivity is below 4%. Looking at the new cases, the decrease that we've been seeing in new cases has been following in every age group. That again helps kind of cement that, discussion, or the discussion that I previously had, that what we were seeing was in fact a community-wide outbreak, because all of our case numbers were all kind of following similar trends. So it wasn't just a particular age group that was getting hit, it was everybody in the community. And as our case numbers have gone down, it has in general been everybody in the community that has been seeing decreased case rates, except for one particular group. So when we look at the 60 plus age group and break that down into 10-year groups, the 60 plus age group is following the general population. Same with, in general, the 70 to 80 age group. Unfortunately, we still have not seen a decrease in the 80 plus age group. That is, a challenge to us, because the 80 plus age group is the most vulnerable and has the highest mortality rate. An individual in the 80 plus age group in North Dakota has between about a 13 and 15% chance of dying. So of everybody over the age of 80 that gets COVID, if you have 100 people that get COVID over age 80 in North Dakota, between 13 and 15 of those individuals would end up passing away from that COVID. So, that's by far the highest mortality rate that we have of any particular age group. So, it is important for us to get that, case rate down in that particular age group. Looking at Grand Forks compared to other counties, particularly our peer counties, we are following the general downward trajectory that other counties have been seeing. So when we look at Burley, Morton, Cass, and Ward, Ward was kind of following the same, precipitous increase in cases, but now they're kind of following the same trajectory down. Cass County and Burley Morton, they've both been kind of following a steady increase in their number of cases, but they've also been seeing the same kind of precipitous drop. That does give me a little bit of pause, wondering why everybody's kind of seeing that same drop all at once. So I'm uncertain if that is due to some sort of testing failure or something like that. So that is something that we will keep an eye on. But in general, I think it is safe to say that we are on a downward trend throughout the state in our number of new cases. And then finally, looking at the state, we are, now more in line with what we're seeing statewide, or, with the statewide average of new cases per 100,000 population per day. Looking at our incidence of new cases, last time I had spoken with you, I had brought up that what we were seeing was kind of a doubling trajectory. So we were seeing an exponential increase in new cases. Fortunately, that has slowed down for us. Generally, when we look, between September and October, we added 2,000 cases, or, a doubling of our total case count over the course of 39 days. And we were expected to have another doubling happen last week. That doubling still has not happened, as our case numbers have kind of trailed off pretty precipitously in the last few days. So what we're seeing is more of a linear increase versus an exponential increase, where you're looking more up and down versus looking more at a 45-degree angle or less. So that does give me a fair amount of confidence again that we are slowing down the spread that is happening in the community. Still something to keep an eye on. That last meeting that I had spoken to you, I discussed what we are seeing with our our case rates, and then you mentioned the projections that I had made, and I had made some relatively scary projections. So I had discussed the projections that we had been, the projections that we had been seeing based off of our previous 14 days of cases leading up to November 1st. And then I'd also discussed the previous 14 days leading up to our last case doubling date, which was the 28th. And both of those, were relatively scary numbers, looking at a doubling of cases, 3 times by the end of January of 2021. Fortunately, again, what we've been seeing lately, and I think this really demonstrates the decrease in cases that we've been seeing. You can see the curve. The blue line is the actual incidence in new cases. The orange line was the prediction that I had given you, and you can kind of see how that that blue line was following that orange line for a significant period of time and has now kind of curved off. That orange dot on the line, that would have been our anticipated case doubling date, and we did miss that. So, what we were seeing, based off of the exponential increase has not kind of came to be, again, another positive sign. Another view, and I'm not trying to saturate you with views, but I do want you to know that we are confident in in the decrease in cases that we're seeing right now. Another view that I had discussed was the estimated doubling time of the incidence of cases. So the estimated doubling time looks back at the previous 14 days, and based off of that, it gives an estimated amount of time it would take for that number to double. So if you have, if you have 100 cases over the, leading up to the past 14 days, and it says you're going to double in, 20 days, then you expect to have 200 cases 20 days from now. So that gives us a good idea of where we're looking at with our case growth. The higher the number, the longer it would take for us to double. So what we've been seeing lately is our case doubling time also increasing at the same time as our our number of new cases has decreased. So we've moved from where we were at with a low of about 23 days up to about I think I have the number on here, 65 days. So we've almost tripled our our doubling time, which again is a really good indicator that we are slowing the spread and growth of new cases. We're moving away from that exponential increase into a more linear increase. Finally, moving on to hospitalizations. This is an area where I do still have some concerns. Looking at our hospitalization numbers, we have not been seeing the same drop in the hospitalizations as we've been seeing in the number of new cases. So the individuals who were exposed that were going to be sick have been kind of coming out of the woodwork. They've been getting hospitalized. It isn't necessarily the same individuals who are staying in the hospital. They are, doing a pretty good job at Altru of moving through individuals, getting them set up for care, and getting them feeling better, but we're still seeing those high hospitalization numbers. We're seeing similar numbers as what they're seeing in Burleigh Morton and Ward counties, whereas Cass County has been seeing a slight decrease in the number of hospitalized cases. These number of hospitalizations are putting a strain on Altru's resources. Altru hasn't been to the, they've had to expand their COVID unit, but since they've expanded to 50 beds, they haven't, I think the closest they got was approximately 48 out of those 50 beds filled in their COVID unit. Since then, the number has decreased down into the 30s right now is where they're running at with the number of COVID beds filled at the hospital. This has brought some opportunity for them to innovate a little bit. They have started an outpatient infusion program for individuals that would have otherwise been admitted to the hospital. They're able to receive some of the medications that you can only get via infusion at a COVID-specific outpatient infusion center. For some individuals, they can send them home also on home oxygen, and then they can do frequent follow-ups until they're feeling better. So we have been seeing Altru kind of change the way that they're providing some of their services to make sure that they can continue to meet the need of the community. One other kind of way that we have met the need in the community is Altru has also received the help of some nurses from the U.S. Air Force as well, which you may have seen in the media. But the Air Force nurses have helped address one of the major issues that Altru was having, which was their maintaining their staffing levels, as they lost staff to isolations, quarantines, things of that nature. Comparing North Dakota to South Dakota and Minnesota, for the longest time I was frequently discussing how North Dakota's hospitalization rates were significantly lower than Minnesota. What we're seeing right now is North Dakota roughly matching Minnesota. South Dakota continues to remain higher than North Dakota. So, this does seem to be a regional issue with the increase in the number of cases and subsequent increase in hospitalizations. Finally, I wanted to touch on deaths. Unfortunately, this has been another measure that hasn't gone down as our case number has gone down. So we are still seeing additional deaths that are happening in the community. Some reasons for that may be that our case rate remains high in that 80+ age group, or some of the individuals who were exposed early on to COVID, they've been in the hospital, they've been getting treatment, and then it can take a significant amount of time for somebody to end up passing away when they are seriously ill with COVID. So we've still been seeing deaths kind of come through from a variety of sources. So that number, I think, will still continue to go up at a similar rate for some time still, which is kind of the unfortunate progression of an outbreak that we're seeing right now, is the unfortunate kind of consequence in the increase in deaths. So right now, as of today, we've had 47 deaths in Grand Forks County. That's been a pretty significant increase over the past couple months. We've added 15 deaths over the past 17 days. Looking at adding another 27 days onto that, we've had almost half of our deaths in the past month and a half. If we look at our doubling time, the doubling time measure that I had discussed earlier for cases, the doubling time in comparison for deaths right now, the time that it would take for us to get from 47 deaths today to 94 deaths would be, it's estimated at 33 days right now, which again is much lower than the 65 days right now that we're seeing for our cases. So I would hope to see that doubling number increase as well, but it is kind of a reminder of the continued progression of what happens when we have a COVID outbreak. And then my final slide, comparing our death rate to other states. Right now, North Dakota as a whole has been seeing a decrease in the number of new deaths. South Dakota, started out their outbreak a little bit slower than North Dakota, but they've been seeing kind of the consequences stack up with increased hospitalizations and increased deaths. So that their trajectory, I think, is still going to be on the upswing for quite some time now. Whereas North Dakota and Grand Forks, I think, the impact isn't going to be as potentially prolonged. North Dakota and Manitoba have also been seeing increases in their case counts and increases in hospitalizations. Right now, their death numbers are staying on the lower side. So the bottom line, looking at our strengths, right now we are on a stable downward trend on the number of new cases and our percent positivity. Our case growth has slowed, which again is a positive sign for the community. And we're seeing kind of all of the secondary measures that we look at related to case growth also pointing in the right direction. Our weaknesses, again, we keep seeing relatively high hospitalization numbers and keep seeing deaths in the community. We would hope that those would level off and start to decrease in the near future, but it is kind of telling of where we're at right now, that that's still a challenge for us. Another driver for those hospitalizations and deaths may be the continued kind of high number of cases in the 80+ age group in the Grand Forks area. Our opportunities, Debbie will touch a little bit on vaccines, but we are relatively close to the start of vaccine distribution. But bear in mind that optimistic projections of the vaccine distribution have herd immunity, happening in potentially May. So it's still going to take 6+ months for us to get the vaccine out to everybody. So this is still going to be something that we'll be dealing with for some time. Our testing still remains, the availability of testing still remains high, uptake remains high, but we have seen a decrease in testing over the past week or so. And then finally, looking at our threats, even though our case counts have dropped precipitously, we're still much higher than where we should be at if we want to, prevent having, continued outbreaks in the community. So we're about 2.4 times higher than the 25 cases per 100,000 threshold, which is kind of the top of what Harvard says you should be looking at if you want to, suppress future COVID outbreaks and help prevent future COVID outbreaks. So, a good target would be to, get the community below 25 cases per 100,000. What we saw, I think, between, the August student outbreak and our current outbreak was we didn't really get our case counts, back down as a community. So we still had a fair amount of COVID prevalent in the community, which eventually ended up, spreading widely. And then finally, we are still going to be waiting to see what happens with Thanksgiving. Generally when we look at holidays, there is, some sort of impact that happens, between 2 and 4 weeks after a holiday. Whether that's an increase in cases or, other things as well. So with that, I am available for any questions. And then I also have additional slides. You got the first version yesterday, but I'll try and get those to you after the meeting.
Madam Chair, this is Tom. I have a question and a comment.
Well, go ahead.
Thank you, Cynthia. We'll get through this together. I'll do the heavy lifting, carry the luggage for you. Michael, thank you very much for the presentation. Love your stats. I just like looking at them. I note that, Minnesota and Manitoba seem to be doing better, but they've been in the mask game and some of the restrictions longer. And so I think that's paying dividends for them. But is it just me, or does it seem like our case rate started to drop after we went to a mask standard?
Commissioner Falk and members of the commission, I'm not quite sure yet whether or not the masks had a definite impact or not. Once we get kind of out of a couple of weeks, then we can kind of make a more definitive kind of look at that. But I'm not at a point right now where I can confidently say one way or the other whether or not the masks helped. We have seen in other states that it has, so that certainly is a hope. So
yeah, I'm just sort of an amateur at it, but I see the drop seems to correlate with about the time we went to masks. And the other thing is another question, but I'm guessing that our hospitalization rate and death rate probably trails a couple of weeks behind the drop in our case rate. Would that be a fair guess?
I think that is a relatively fair assessment. The hospitalization, this time around, it seemed like the hospitalization rate did kind of follow that trend. And what we're seeing right now with the continued kind of relatively high number of hospitalizations, I think is kind of, it is kind of manifesting out. So with COVID, there's kind of two different types of illnesses that happen. The first type of illness is kind of like what you could look at as like a primary type illness, where you get a pneumonia related to the to the actual COVID infection itself, a pneumonia or something similar to that, that causes the shortness of breath and requires hospital admission for things like oxygen and things like that. Another type of illness that we see with COVID is kind of a secondary type illness. So COVID can cause a lot of weird kind of systemic issues, such as clotting challenges and things like that. So some people will end up with blood clots in their legs or in their lungs, or strokes or things like that related to COVID. Sometimes there's like intense kind of inflammatory response in the body, where it it starts to kind of attack things that it's not supposed to and things like that. That's also something else that we see with COVID, and those kind of come, it seems like, later on in kind of the progression of an outbreak, from what I've gathered from other places. And those tend to be the more challenging things for us to treat as well. So the idea is that we may have seen the prolonged kind of hospitalizations that we're seeing, maybe as we still have some lingering COVID in the community, plus those additional kind of issues that are kind of coming up with having people progress in their illness and get even sicker, even significantly after the time of their first positive.
Thank you for the additional information and everything you and everybody else in public health is doing. Appreciate it.
Thank you.
Are there any other questions of Michael at this time by the commissioners?
Madam Chair, this is Dave.
Yes.
Michael, sometimes the hospitalizations don't come down as fast as the case numbers because of a lack of testing. But are we still robustly testing as we have before? Because if that's the case, then it looks like maybe Commissioner Falk's comment means that it may be, the hospitalizations may be going down soon too. What's your view of the testing?
Commissioner Engen, as a community, I think right now our testing availability is still very, very good. So I think if an individual wants to get tested, I think there's still good availability of testing. We're still running the same community kind of testing schedule. Plus, we also have Altru providing the drive-through testing at the Alera Center for individuals who are symptomatic or close contacts of a positive case. Plus other kind of private enterprises, either supported, in cooperation with, public health, or kind of branching out on their own to provide testing. There's a number of different avenues right now for testing in the community, which is phenomenal. So, what we're seeing right now isn't really like an increase in the percent positivity. So that's giving us an indication that individuals who are wanting to get tested because they have symptoms or something like that, that they are able to get tested. So I think the general decrease right now and what we're seeing in testing is due to a decrease in the number of people, one, showing symptoms, and two, there is probably a holiday factor in there with individuals not wanting to get tested over a holiday. The third factor may be some delays with one of the testing facilities. The state does contract some of their testing with a lab down in North Carolina called Mako. They have had some challenges with keeping up with testing, which has increased response times. That's been something we've been seeing as a state. I haven't necessarily seen that kind of bear out as much here.
Thank you.
Are there any other questions of the commission of Mr. Dulitz? If not, then we'll move on. And Debbie, thank you, Michael, for all the information that you provide. It's very helpful. Debbie, do you
Thank
want to
you.
continue on then?
Yes, Madam Chair and members of the commission, I have a few more updates for you. I don't have slides for this portion of our update, but I wanted you to be aware that you've probably been reading in the news that vaccine is on the horizon. The Pfizer vaccine is awaiting their FDA approval for emergency use authorization, and we anticipate that we could get doses as early as December 14th. The dosages, the number of doses we'll receive will be relatively small, but they anticipate that there will be new doses each week. The Moderna vaccine applied for their FDA EUA approval yesterday, and so it's anticipated that that would be available possibly December 21st. So we have two vaccines manufactured here in the US and on the horizon for distribution. Both of those vaccines are showing pretty strong effectiveness at about 95% for both of them. And then today, AstraZeneca asked for authorization from the FDA. Their phase 3 clinical trials are not as far along and don't have as many participants. They have about 24,000 versus the 30 to 40,000 in the other two products, but they are also seeking that approval from the FDA. That may take a little bit longer, but the good news about the AstraZeneca vaccine is if it does prove to be as effective, it's less expensive, and the storage and handling is much, much simpler. The first two vaccines both require cold chain storage and handling, some of it ultra cold. So it will be a little bit more challenging, but I believe with our distribution plans and our allocation plans for getting this vaccine to all of the providers in our county that have indicated an interest will mean we'll be vaccinating it within the time frame that it can be refrigerated. So that's good news. We've been doing some planning with our partners. Every other week, we meet with those that have an interest in vaccinating either their healthcare providers, their patients, their residents in the case of long-term care. And we have really good participation in those meetings. And I think communication is just going to be the key, that we know who everybody is and we can contact them as the vaccine comes to us, and we have priority groups that are ready to receive it. The first phase, what we're calling phase 1A, will be healthcare workers. It's also anticipated that long-term care, healthcare workers and residents will also be in that phase 1A as well. The Advisory Committee on Immunization Practices is meeting today, so those decisions will be finalized this week. Also this week, the North Dakota COVID Vaccine Ethics Group will be meeting, and they will be making some decisions about the phase 2 groups, which are what we're calling essential workers. And there are a lot of categories of people in the essential workers group, which includes things like your infrastructure, police, fire, PSAP, food distribution and production, teachers, did I say teachers? Anyway, there's a lot of groups within there. So North Dakota will be prioritizing within that phase 2 group. So we expect that once vaccine arrives and we make it through healthcare workers, we'll move very quickly to the next phase as well. And that we might even have to develop some waiting lists in the event that we have open vaccine and we want to make sure we administer it. We can call people in to make sure that that process is really seamless and smooth as possible. We know there will be issues along the way. I'll move off of vaccine unless there are some questions that anybody has. One thing I should also let you know is that we do anticipate, while this is not a live vaccine, it's a messenger RNA vaccine, it does have some mild side effects, and they may be more pronounced than your usual vaccines. So we are trying to make sure that we prepare people for what they might experience, like a sore arm or not feeling well. And we're also advising healthcare institutions that they may not want to vaccinate large numbers of similar groups of people all at once, but stagger that a little bit in the event that they would have people calling in sick the day after a vaccination. Tomorrow there will be an update by the North Dakota Department of Health. There will be a news conference. I don't have the exact time, but I will send it out as soon as I have confirmation of that. And it will include a vaccine update for North Dakota. And then also they will be making some recommendations based on some new CDC information on quarantine guidelines. I don't have all the details on that, but there have been some new research that's been proven that they can make some different recommendations about quarantine. So more to come on that. Unfortunately, we've been so used to saying you can't test out of quarantine. And now, unfortunately, I think we're perhaps going to have to backtrack on that, because I think there will be some circumstances where people will be able to test out of quarantine. There are 9 zip codes in Grand Forks County that have at least 5 cases of COVID, and I sent you that information earlier today. It's just an effort to make everyone aware that this is not just an urban center issue, that we have cases in the rural areas of our county as well. It's not perfect data, but I think you can get a sense of what's happening across Grand Forks County with that information. A couple of updates on the staffing that you have authorized. Teresa Knox has been working on interviewing. It has been really challenging to be able to recruit nurse positions. And as you can see, nurses are in demand everywhere. And when we're calling the military to help us out, that gives you some sense of just how desperate things are. But she anticipates making an offer to a nurse this week for one of the school nurse positions and continues to interview for that one, and has some new leads on jail nurse positions and jail nurse candidates, I should say. So far, our 2 jail nurses are holding strong on the work that they're doing, and things are going okay there, but we just want to make sure that they get some respite, that we have a backup plan. And then lastly, the governor will be doing a news conference on Thursday. At a meeting this morning that we had with the Chief Operating Officer for the state, Tammy Miller, we did ask that the governor's office give us some good, solid information about their plans for the orders. There's currently an executive order on capacity for like restaurants and bars and various places like that. And then there's also a health officer's order requiring the masks. Both of those have a sunset on December 14th, I believe. And we want to be prepared that in the event that the governor and the state health officer would choose not to reissue those orders, that we can have a plan here for Grand Forks County. As you recall, Dr. Walls did issue orders on both of those, and they were rescinded when the governor's order came through the very next day. But I think it would behoove us from a public health perspective to make sure that we have those back in place in the event that we don't have state orders. So I've asked Dr. Walls to meet with the state's attorney on that particular topic and look at penalties so that the penalties could be similar to what's in place right now. Overall, we're getting good compliance, though. I think there have been about 20 requests for, what should I say, law enforcement to check in on some situations. And we continue to get some reports of restaurants that are exceeding their 50% capacity. And we've been working through that with our health inspectors right now. So I think that's pretty much everything I have to report. And I know that was kind of rapid and a lot of topics, but I'm happy to answer any questions.
Does anybody have any questions for Debbie? Okay, I do have one, Debbie. With the COVID, obviously we're not yet through the Thanksgiving holiday to see what numbers are going to happen. But what about the incidence of the flu, of influenza? Are we starting to see influenza in our community at this point or not?
Madam Chair, that's a very good question. We are starting to see a little bit of flu statewide, and we do get a report every week. And that's a good reminder to me that I should submit the report or forward it on to you when I receive it, or you can check in on NDFlu. I think it's ndflu.com instead of .gov. But at any rate, we think that there may be less of an impact of flu because of people masking. So there is one potential positive impact of our mask orders is that we might see less influenza transmission, which would obviously be very good, given that the flu vaccine doesn't have nearly the efficacy, especially in older people, that we're even seeing with the COVID vaccine. So we usually try to protect a large number of people to kind of cocoon those who don't have the strong immune response to influenza vaccination. The good thing is flu shots are widely available, and they're inexpensive. They're covered by insurance, and they only require one shot. Whereas COVID vaccine, we will need to vaccinate everyone twice. The schedules are a little bit different for those. Some are 21 days apart and some are 28 days apart. But that's a good question, and we will definitely be monitoring influenza vaccination rates as well as influenza like illness throughout the season. We are a little bit behind where we were this time last year in terms of flu, which is good.
Thank you very much for that answer. Are there any other questions of Debbie or Michael? If not, then thank you both very much for your information. It's very helpful. We will move on to the next item in the agenda, which is Emergency Management Director Kari.
Good evening, Madam Chair and members of the Commission. I just have a really brief update. We have secured our storage facility and we will be starting our move tomorrow. Unfortunately, due to the amount of stuff that was in there, we did end up hiring Wayland's to give us a hand getting everything out of there. And then I've already planted the seed with the city to pay for at least half of that, if not all of it. So more to come on that, but the move should be completed within probably 4 to 6 hours tomorrow. That's all I have, Madam Chair. Thank you.
Wonderful. Thank you very much. Good luck with the move. The next item on our agenda is the Director of Administration, Mr. Ford.
Yes, thank you, Madam Chair and members of the Commission. Good afternoon. I have a couple things for the board. The first is an update or really a question on the county's reopening plan. So you'll recall that the County Commission approved a county reopening on January 4th, but that was by appointment only. And each department was supposed to put together a plan on how they would bring employees back to the office and how they would see constituents, clientele by appointment only. And I'm happy to say that we have, if not all of them, probably 98% of them in, and I sent those all to the board this morning. So there's a good plan in place. However, some of the county staff have been inquiring as to whether or not it is still the Commission's intent to have that reopened by appointment only on January 4th, due to what COVID cases have been doing. And we got some pretty good news today from Mr. Dulles. However, of course, we don't know what's going to happen with the holiday season and what's going to happen with school going back into session. So a lot of staff are concerned. They're wondering if we're still planning on that January 4th date, or if the Commission wants to err on the side of caution and push that date back. Some of them need to make some plans as far as childcare, whether their children are homeschooling or if they're at school, or whether they can get daycare or not. So we do have some staff that are back in the office. I think those have all been at the special request of departments, which the board has approved. But I'm here to ask, really, what are the wishes of the board, just to give our staff some peace of mind?
Any comments the commissioners would like to make at this time?
Madam Chair?
Yes.
I guess my thoughts on that, based on things that I'm reading and what we can anticipate, and the unknowns, which is a biggie, is that it would seem to me I would be leaning towards putting off the January 4th reopen at this point. Staff the majority of them are in the office working remotely, but public isn't, in most instances, not able to come into the agency. And business is being conducted as usual, and services are being met timely and without any complaints received. At least I haven't gotten any, but given the unknowns and having just come off 2 holidays and the timeline there, when things start showing up, to me, I would even consider maybe going another month out so we can see the effects of Thanksgiving and or Christmas, because they aren't going to show up until maybe 2 weeks after, where we can start seeing the numbers. And I would rather be safe than sorry. And there's a cost to moving people in and moving people out. And to me, it's just too soon yet.
Diane, are you entertaining a motion at this time or just merely talking for discussion?
For discussion.
Okay, anyone else want to make a comment?
Madam Chair.
Yes.
Commissioner Ross. I feel that the January 4th opening is a prudent time to open. We've been closed a long time. I don't think all services are being met. Sheriff Schneider has outlined in a letter to all the commissioners the things that he's had to accomplish because the offices are closed. And so schools are going to go back in session in January 4th. That's what their plan is. And I just think the county should be opening too.
Thank you for your comment. Any other comments from commissioners?
Commissioner Peach, Tom here. Or actually, Chairperson Peach, Tom here. I tend to agree. So I agree with both commissioners, but I tend to agree with Commissioner Knopf here. I think this entire COVID problem is really fluid at this time. I mean, we're seeing some drop in our cases, which is great. We're still far above on a per capita basis what Minnesota is right now. But, we're being warned nationally that the rate is going to go up. And I'm not sure that it's going to happen here. I would hope not, but, we tend to follow what's going on in the country. And sometimes we're a little slower. And so I think we have to keep that in our thoughts when we're making decisions. Now, I'm going to suggest what we should do is that we put this off until our next meeting, which would be the middle of December, and maybe we'll have more information at that time. And my thought would be that if we are going to open up, or if we decide we are, we do it 30 days from the date that we make our decision. So if it's, if our next meeting, for instance, would be the 15th of December, we would then open up on the 15th of January if we decided that was prudent. But I don't think at this point we can know for certain what's going to happen in the first part of January. And the holidays just concern me because people traveled so much. I appreciated Michael's comments on they thought testing was down because people weren't testing because they wanted to travel, which is a terrible idea because if you're positive, you're taking that infection home to your relatives. So if that in fact was occurring over Thanksgiving, it's definitely going to occur over Christmas. So I suggest we put this off for 2 weeks and then see what's going on. Thank you. That's all.
Any other comments?
I have one more. I just think that the public.
Just wait, Diana's speaking, so we'll go back to you, David, as soon as Diana's done.
Sure.
Is that
I can't hear Diane.
Louder, please.
Now that we see that the numbers are going down for now, today, I think people's guard is going to be let down as well, and because they're tired of all of this. And so I think as a result of that, we could see more infection as well because we're letting down our guard.
Okay, David, you had a comment to make?
Yes, I have a question about the timing. if we wait until our next commission meeting to make the decision might still be that we're going to open on the 4th. And that would not give people enough time to react, perhaps. I'm kind of in favor of just making the decision to move it to January, say 12th, when our commission meets again, rather than the 15th, which happens to be a Friday, but somewhere in that week. It would give us 3 weeks or so from our next commission meeting, at least 3 to 4 weeks. So it seems to me we maybe ought to move the date a couple of weeks now, so that we can evaluate properly at our next meeting. I don't know. What do you think?
Chairperson Peach, this is Tom again. That's
Yes.
kind of what I was saying, Commissioner Engen. My thought is that if we move this down the road till the middle of December, whenever our next meeting is, that if at that time we decide it's prudent to open up, that we open up 30 days from that date. So we would just, we push it out 30 days from whenever we make our decision so that we can have everything in order. I was talking with Mr. Ford today, and they're still down in the finance department or whatever. We've got some curtains that are up down there, and there's a lot of work to be done before we can open up. And actually, Mr. Ford is going to talk to us about some of that later on in the meeting here. But I think we can accomplish that, and I do want to give the employees hopefully 30 days to get everything organized.
Well, at this time, if no one cares to entertain a motion in front of the commission, we could table it for 2 weeks. Mr. Ford could add the under his agenda assignment. It could be added as the county reopen date, and that could be a discussion that would take place on December 15th, which is our next commission board meeting. Are you all comfortable with that?
Yes.
Mr. Ross?
Yep.
Okay, then
Yes.
what we will do, I've got shaking heads both on screen and in person. And so what we will do is the county reopen date will be another agenda item moving forward at our next meeting in December, which will be on the 15th of December. That too should give some time to see what happens during the holiday of Thanksgiving and get an idea of moving forward what we're looking at. So the next item, Mr. Ford, is the county office building remodel.
Yes, Madam Chair, members of the commission. So Ms. Wamstead and I have had a series of conversations with pertaining to this subject, and then of course with the ICON folks. You'll recall when I first brought this concept to the board, ICON's estimate was this would cost $60,000. You will see in the packet that Ms. Nelson sent you last week that ICON, per the board's instruction, went out and sought some different quotes from different contractors here in town because we were under the public bidding threshold, well under it, by the way. You'll see those bids came back, and the lowest one was $103,800. So just a little bit more than $60,000. They were all good bids. They were all relatively close to each other, so I don't think we saw any anomalies there. Just the mark was missed on the estimate, unfortunately. So Ms. Wamstead and I agreed that this is considerably more than what you approved, so we need to bring this back, or I need to bring this back, excuse me. But also that we're looking probably at about $40,000 in addition to the 103 for the state's attorney's office improvements for her staff to protect them and mitigate some risk. And you'll also recall a couple of meetings ago that ICON estimated about $20,400 in engineers and architects fees. And so when we do the math there, we're looking at $164,205 total project. which is about $35,800 under the public bidding threshold. So just making you aware, obviously, that we're looking at a higher price tag than before. We were looking at taking these expenses out of CARES Act monies that the county did receive. Ms. Wamstad, anything I've missed or anything you'd like to add before I move on?
Thank you, Mr. Ford. I think you sufficiently summarized kind of our discussions with ICON. I would just, to make the commissioners fully aware, add that the threshold for public bidding is 200,000. And what we have to consider for that is the full amount of cost. So that includes the architectural and engineering and the full scope of the project. So even though a lot of these projects are for different departments, because they are for the same purpose and one is not contingent on another or anything like that, we would consider the whole. So I think it is important to note that we are 35,000 shy of that public bidding requirement. And so it would be up to the commission's discretion if you wish to publicly bid it, for the reason that it is getting somewhat close to that threshold. And if it did come back with a higher price tag than expected, we would then have to publicly bid it if it exceeded that $200,000 threshold.
Okay, thank you very much. So, Mr. Ford, what are you suggesting at this point?
One other thing, Commissioner Peach, that Mr. Grzeszewski has made me aware of, and Ms. Wamstad, we didn't include this. Mr. Grzeszewski anticipates that once this wall is erected in the first floor south area, he anticipates some rerouting of the HVAC system. I think Mr. Grzeszewski's on, but depending on what that costs, that probably drives us closer to the 200,000, Ms. Wamstad. I don't know, Mr. Grzeszewski, if you're on, if you wanted to just give the commission your thoughts on what that HVAC reroute could cost.
Yeah, thank you for the opportunity to speak. I'm unsure or unwilling to put a speculative number on what the dollars would cost for that, but I know we're going to be looking at a new zone created, a new VAV installed with a hot deck in it in order to manage that zone that's going to be broken up there, so we don't have cold negative air coming in from the south entry penetrating into the office areas that are already a challenge because of the glass wall being there that wasn't taken into consideration some years ago. To put a price tag on it, I can't imagine we would be $20,000, $30,000, but I don't know where we would be at for that, for the added project. I don't have those budgetary or preliminary numbers to put together yet. I was hoping to have, but just like every industry out there, with our building management being handled with Johnson Controls, that was my first reach out to them, and a lot of their crew has been dealing with either COVID positive or quarantine due to possible exposure. So every time I prospectively look at a date to meet with them in order to do some more talking with them on this, they're scrambling to keep their head above water on work coming in rather than dealing with bidding this potential project. So it's been a challenge to get them on site and get those final numbers put together, so I have a budgetary number to give you.
Thanks, Bill. Haley, if we were to lump in any kind of HVAC work, it's on an existing system, would that have to be included with the ICON project? the number that is?
Mr. Ford, members of the commission, my research on this subject is that when we consider the public bidding threshold requirement, we'd consider the project as a whole. So if it's something that's an element of the project as a whole, we should consider that in our decision of whether or not it should be publicly bid. If it's something that would be contingent upon some result of the construction or something like that, that isn't a certainty, then it wouldn't necessarily have to be considered. But if Mr. Gershesky feels that this is something that would be necessary as a result of these renovations, it should be considered in our determination of if this project should be publicly bid. One additional factor I would add is that if the commission decides to publicly bid the project, that's kind of the safe bet, in that if bids come in higher than anticipated, we have already went through that process to make sure that there was adequate opportunity for all contractors to be noticed and submit bids. If we choose to do an RFP and it turns out where the bids are higher than anticipated, then we need to start the process over and go through the public bidding. So sometimes when we talk about being close to the threshold, it's a safer bet just to publicly bid. And then we make sure we don't have any of those issues on the back end.
Thank you.
I think if we were to ballpark the HVAC, we're probably another 10 to 15 in addition to the 164.2. So again, climbing and getting closer to that 200,000 threshold. And I'm planning to go back to Icon and ask them, depending on what the board decides today. I do plan to respond back to Icon and tell them they need to go and get some more bids on the state's attorney's project, whether that's just reaching back out to the 3 contractors that responded to Icon and adding the state's attorney's office or not. That depends on what the board decides today, but I think we still need to have some contractors submit some bids to the state's attorney's portion.
Thank you, Mr. Ford. What are the wishes or what are comments from board members?
Madam Chair?
Yes, Mr. Engen.
Dave. I don't see much alternative. I think that we're going to be very close to that threshold. We may go over it and then we'd have to bid it, and it's just going to take longer. It strikes me that we should go ahead with public bidding. How much will this project be delayed though by doing this?
Madam Chair, Commissioner Engen, and Ms. Nelson, correct me if I'm wrong, but we would have to put a RFP in the Grand Forks Herald minimum to appear once over 3 weeks. Does that sound right, Ms. Nelson?
Once a week for 3 consecutive weeks?
Right, yep. Okay.
But that makes an issue though, because the Grand Forks Herald is only printed on specific days, or we can do it online.
It's printed on Wednesdays, and that's the only day they do those types of notices. So
okay,
be fine.
So what we should do then, and I don't believe we need a motion for this, do we, Ms. Wamstead, to move forward with public bidding? That will give Mr. Gershesky a chance to deal with the heating and duct units to see what the cost would be for those, correct? Do we need to have a motion on this?
Madam Chair, members of the commission, I think it couldn't hurt to do a motion if the commission did wish to pursue the public bidding option, then the record would be clear as to the decision of the board.
Okay, thank you very much.
Madam Chair, Yeah, I initially, when I started out this afternoon, I was going to push to move ahead because time is of the essence, and every day that we slow down is a problem for us. But I wasn't aware of the HVAC thrown in there, and that really puts us near it. We actually have three, I don't know if you, I guess you can't call them bids, but we have three competitive proposals that are fairly close from three major contractors in the city. So I like that. I'm fine with the motion. I think what we should do is move expeditiously with a request for a proposal through the architects, but include the entire packet in that proposal so we know what the total is going to be. And I don't want them bid separately because the state's attorney's project is a much smaller project, and some of those get shuffled off to the side, and we might not see a contractor in there until September. So I think we need to put it all together and move forward.
This is Nick West. Can I say something here?
Sure.
Sorry, thank you. I didn't know how to raise my hand or get your guys' attention here. Something to consider with all this is, and I apologize, I don't have the background on this project at all, but with the whole bidding, public bidding thing, if you have an architect involved, they're probably going to want more money because it's going to require more work to put a public bid together, because you typically need more plans and specs and more details to put out there to get that competitive bid out there. So that's the challenge with public bids. It's a lot. It is more work. I know when in our industry, when we have to do a public bid, it's a lot more work than just going to a couple of contractors, verbally explaining the job or having a couple of little sketch sheets and say, hey, give me a price for this. It's a whole nother can of worms. It's a whole nother step of work. So if you go back to your architect and say that, just be prepared. You might ask for more money and more time because he's gonna have to put some of those bid documents together. So just a heads up warning there. Thank you.
Madam Chair, if I may, I'm going to agree with Mr. West. I foresee they'll request more funds because it is more time. We have a budget of $20,405 for architects and engineering fees. We're almost at 19 of that now. My recommendation to the board would be if we publicly bid that we'd have Icon do it on our behalf, because they put together all the plans, all the drawings, they've already initiated the discussions, and to have myself or Mr. West go back and start all over would not be very efficient. So here's a thought, and I'm just throwing this out for the commission's alternative. I know and I agree time is of the essence. Could we have Mr. Gershesky try again to get Valandries or whomever into the building and give him a pretty good estimate on what that zone could cost? If we get that estimate, we can put that in with 3 other estimates we've received from Icon. And if we're still under that 200 threshold, maybe we just proceed because we're under that threshold. And if we're over it, I could perhaps work with Ms. Nelson and Ms. Peach. We could do a special meeting just to approve or whatever you want to do. But perhaps we have Mr. Gershesky work diligently tomorrow on getting a contractor into the COB and getting us an estimate, and so we know where we go from there. Or you can make the decision tonight to publicly bid, but that will drive up the E&A budget from Icon.
Madam Chair?
Yes.
Does we've got 18,000 on Icon already. Does that count in the 200,000?
It does, sir. Yes.
Okay, so did that count in where you figured it at 160 or so? Was that?
Yes, sir. Yes, sir.
That was included?
Icon gave us an E&A estimate of 20,405 when this started. And we have today we have been billed $18,185 of that 20,400.
Right, but
Yep.
in addition to the 103, we've got that 20, and then what's the rest? State's attorney?
Yes, sir. We have
Project?
40,000 at the state's attorney, and that's a very, very bold estimate on Icon because they were so far off on the Cobb that they went pretty high on the estimate. And then we're at 103.8 for the Cobb. So that's how we go 2405, 40,000, 103.8. That's how we get the 164.
So it's mostly the HVAC issue that would put us over the hump.
It is. So basically, and I'm not in the maintenance HVAC field, but a $35,000 price tag to create a small zone would probably put me on the floor.
Madam Chair, this is Tom. You know, I appreciate Nick chiming in on this, and he's right on it. It does drive up the cost, but it immediately brought me back to one of my projects that I supervised, which gave me too many gray hairs, involving the juvenile detention center. And we did not get a request for proposal on that. And it was sort of flying by the seat of our pants. And I think I forgot now until we started talking about it, but we really need to have, I think, a request for a proposal, because that project involved all kinds of arguments back and forth that this was not included or it was included. And I finally got Icon in there. And they explained to me that most of that would have been taken care of had we gone through them. And they didn't think we needed to at the time. And they were upfront about that, but they said we could have solved that problem. And that was like a $30,000 project. And if you remember, Bridgie Hansen had to come in and talk to us about it, and it was just nonstop problems. So I really think we want to have Icon involved, let them deal with the contractors as to what they need to do and not do. It's going to take a little more time, but believe me, whoever's involved here from the commission, you don't want to be over there trying to argue each little screw and nail and door that they say isn't in or is in the project. So let's let the architect deal with it.
Are you making a motion, Commissioner?
I'm gonna, yes, I've done a 180 and I'm gonna make a motion to proceed to bid this project, get a request for proposal started with Icon and have them bid this project, including the State's Attorney's Office, the Cobb, and the HVAC system, if they say they can put that in the bid, which I think they can. And, you know, we're getting close to the $200,000. We really should marshal the public's money. And I think it's a good process. So that's my motion.
Okay, is there a second to that motion?
I'll second it, Dave.
All right, discussion. Does anybody want to bring anything up?
Madam Chair, could
Yes.
I just inquire for clarity's sake? Commissioner Falk, when you mention request for proposal, you're referencing the public bidding requirements, following
Right.
those requirements? Okay.
Right.
Thank you.
But I think what I'm saying is that Icon will narrow this project down for us, and they'll set the parameters much better than if we're just kind of flying by the seat of our pants, especially on a project this large.
The scope
Thank
of
you.
work would be more specific, correct?
Exactly. That's why you're the chairperson. Thank you.
Right. Then I do have one question for Ms. Nelson. We talked about using CARES fund dollars previously with the beginning dollar amount, and obviously it has grown substantially. Will there be CARES Act dollars available to cover those costs?
Madam Chair, member of the commission, yes.
Okay.
We got an additional $690,000 in CARES funds. And so we're at about 1.2 with what we've spent and what we have pledged to spend. And we still have about 1.2 million.
Okay, thank you very much. Any other discussion? If not, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. Then Mr. Grishewski will get some information together, and Mr. Ford, you will speak with ICON, correct?
Madam Chair, this is Tom Ford. I did not catch what you said.
You will speak with ICON regarding this project, and then
Yes.
Mr. Grishewski can get a hold of someone just to get an idea of what the HVAC is going to cost.
Yes, ma'am. I'll circle back with Ms. Wamstead, and then we'll reach out to ICON and explain to them what the board's wishes are, and we'll make sure that the HVAC is included in that. We'll take care of that. The only other thing, ma'am, this wasn't on the agenda, but it's just a kind of an informal for your information. The county led a COVID tabletop response exercise on November 23rd. And it was really hats off to Kari Gels. She put it together and coordinated it in very short fashion. And I know that the University of North Dakota was heavily involved. Altru was heavily involved, public health, Grand Forks Public Schools, the police department, the fire department, they all participated. Our institutional partners were very supportive of this exercise and they also encouraged the county to lead it and put it together. From what I've heard, it went very well in visiting with folks from Altru, visiting with folks from Grand Forks Public Schools. President Darmacost has shared with me his appreciation for the event, and it went very well. They conducted the tabletop exercise using Mr. Dullett's projections in 3 phases, as if cases are today. 50% of his 38,000 projections and the 38,000 projections. And the point really was just to see how each entity's infrastructure would be taxed in those 3 scenarios. And Ms. Gels, do you have anything you'd like to add for the board's benefit?
Are you available?
Kari, we can't hear you. Well, Kari might be having some mic problems, Madam Chair, but it went very well, and our partners expressed a lot of gratitude to the county commission and to Ms. Gels for leading it. So just wanted to share that with the board.
On behalf of the commission, thank you very much, Kari, for all the work that you put into that exercise. That's wonderful. And the city administrators were working in that project as well, correct, Mr. Ford?
Yes, Madam Chair. I had discussions with the city administrator and mayor's office. I had discussions with the UND president's office, Dr. Weiser from Altru. I wanted to just make sure, because we're in COVID times and everybody's taxed for time the way it is, I wanted to make sure that we had their support in asking their employees to participate, and they were all supportive of it. So we had a good showing.
Wonderful. Thank you very much. Is that everything then, Mr. Ford?
Yes, ma'am. That's all I have.
Okay, the next item on the agenda is the state's attorney, Ms. Wamstead. Do you have anything to report?
I do not have anything today. Thank you.
Thank you very much. The next item is committee reports. Commissioner Ross, do you have something to report?
Well, just the MPO, we met. We also had a meeting with our with Lang Magnuson a few weeks ago, and we actually passed it in the last commission meeting on a couple of properties. And other than that, that's about it.
Thank you very much. Are there any questions of Commissioner Ross? If not, then we'll move on to Commissioner Knopf.
Thank you. I also participated or didn't participate, but I attended the COVID tabletop exercise. It was a 4-hour training, and they did an excellent job. And so hats off to Kari and the team that put that. The last I saw, there were about 8 people, I thought, that showed up on the Zoom as participating, but there could have been more than that. But a nice exercise. So, and then also I just want to thank.
We can't hear Diane right now at all.
Please speak louder.
Okay.
And pull your microphone close.
Okay, so, and I also just want to thank David and Tom Ford for their participation in the legislative forum that was held on, I think it was the 19th of November. You did an excellent job, and just thank you so much for doing that. That was the school system had sponsored that, so, but nice job, thank you.
Anything else, Diane?
I have nothing else.
Okay, any questions of Ms. Knopf? If not, then Commissioner Engen.
Thanks. To follow up on the county legislative priorities meeting that Commissioner Knopf just mentioned, I think we all received copies of the potential legislative issues from Mr. Ford. And we should kind of keep those handy and be thinking about those as we go forward, because that legislative session is going to be on us soon. And some of those things are going to be real important to the county. So that's all I have. I've got EDC this week, but that's all that's gone on since last meeting.
Okay, thank you. Any questions of Mr. Engen? If not, Commissioner Falk.
Thank you. Not much going on. I've been doing some things with human resources and the correctional center. Unfortunately, things have made a turnaround out there with Mr. Burkholder's report on COVID cases, and I think you probably got updates on that. But I do want to just give a hats off to Michelle and Roberta in Human Resources. They took it upon themselves to cook and serve some meals out at the correctional center for correctional officers the week before Thanksgiving. And I think that was just a wonderful thought, and I'm sure helped morale out there, which is, you know, it's a difficult time, but that was just great of those two people to come up with that plan. And we appreciate it very much. Thank you. That's all.
Thank you very much also to Michelle and to Roberta for doing that work. That's very much appreciated. The next, I have nothing to report under committee reports. The next item is unfinished and new business. First thing is board applications received.
Madam Chair, members of the commission, that's just informational. It will come up at the next meeting for appointment.
Okay, and there is quite a significant list of various committees and a nice list of individuals who have made application. So that's wonderful to see people wanting to be involved. The next thing under court.
One question.
Yes, yes.
With respect to that, are those different boards, are they going to make a recommendation to us on who they would like to see appointed? That's kind of what we've done in the past, is that you know, they've received the applications, we've got copies of them, but what they've done is made the recommendation on who they would like to see sit in on their board. You know, a lot of times, I mean, most often they've had contact with that individual, they have a history there, knowledge of them. And so I think we changed that, how we did that maybe a couple of years ago, where it wasn't just the commission that appointed them. We changed it so that they made a recommendation to us. So all I'm asking is that what we're looking for again? Is that the process?
Madam Chair, Commissioner Knopf, members of the commission, we have never, ever requested the boards make a recommendation back to the commission. We can do that. we can do that at this meet.
Yes, we have done that. We.
Yeah.
that has happened a couple
Yeah, we've done that.
I think the boards have stepped forward, but we have never reached out the other way and said,
Right.
they came to us and said, this is who we recommend, or they have given a letter, but we have never asked them ahead of time. All we've done is publish this in the paper. Anybody who is currently serving receives an application, and if they want to continue to apply, they have to continue to serve, they have to reapply. But we can certainly reach out to these boards, which we haven't done in the past, but we can do it before the next meeting to have them respond back, because we have never, ever, they have on their own done it, but we have never reached out to them to do it.
Then it
Madam
may be
Chair?
a good idea.
Madam Chair,
Yes.
I think it's a good idea to reach out to the boards. When I look at resumes, I know some of the people who are reapplying, but there's one of them where there's another person who's applying and I don't know anything about that person. Anyone who's applying, if there's a contested situation with more than one applying, maybe they should be offered the opportunity to come to the meeting or, on the Zoom meeting or something. Because it's very hard for us to evaluate qualifications without some input from these boards.
And I can do that. I can send them a request that the commission would like their recommendation before the 15th of December.
Okay, then we will, Ms. Nelson, if you would do that, that would be very much appreciated.
I will do that.
It will be helpful for the commissioners then to narrow down the number of individuals that are applying for the positions that are available. So that would be great to have that information. Okay, under correspondence, we have a 4-H thank you. Thanking us for, I think it was for funding, wasn't it?
Yes.
Okay, thanking us for funding for an event that they held. Other than that, I do not believe we have anything else on the agenda. And so would someone like to make a motion to adjourn the meeting?
Chairman Beach, I would move that we adjourn.
Okay, is there a second?
I'll second.
Give me a roll call vote. All those Paul, can anyone want to keep going? Oh, he waves. Okay, so, okay, then opposed, same sign. The motion is carried.